The Senate will come to order. I ask everyone present to please rise and recite the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. In the absence of clergy, let us bow our heads in a moment of silent reflection and/or prayer. Reading of the Journal.
In Senate, Sunday, January 21st, 2024, the Senate met pursuant to adjournment. Journal of Saturday, January 20th, 2024 was read and approved. On motion, the Senate adjourned.
Without objection, the Journal stands approved as read. Presentation of petitions, messages from the Assembly, messages from the Governor, reports of standing committees, reports of select committees, communications and reports from state officers, motions and resolutions. Senator Gianaris.
Mr. President, can we take up the reading of the calendar, please?
Secretary Reed.
Calendar number 76, Senate Print 158D by Senator Krueger, enactment of the General Business Law.
Read the last section.
Section 3, this act to take effect July 1st, 2025.
Call the roll.
Adabo, Gianaris, Krueger, Ort, Stewart, Cousins, White.
Announce the results.
Ayes 56.
The bill is passed.
Calendar number 79, Senate Print 1003A by Senator Hinchey, enactment of the Public Health Law and the Insurance Law.
Read the last section.
Section 8, this act to take effect 1 year after it shall become a law.
Call the roll.
Adabo, Gianaris, Krueger, Ort, Stewart, Cousins, White.
Senator Hinchey to explain her vote.
Thank you, Mr. President. It's been over a year since Roe v. Wade was overturned, and one of the things I know so many of us in this chamber are incredibly proud of is the fact that we have continued to provide health care, including reproductive health care, to people who need it across our state. And yet, in many communities, especially in rural communities, we are seeing healthcare networks and hospitals deny care for folks based on policy-based exclusions, including reproductive care, gender-affirming care, and end-of-life care. In rural communities and marginalized communities where we already see a lack of access to health care, this bill will make it so that we can clearly identify healthcare deserts, ensuring that we can not only bring in the additional care that people deserve, but also ensure that those institutions that are looking to close, whether that's the maternity care in Columbia County that closed in 2019, or the Troy Burdette Birthing Center that is on the chopping block right now in Troy that serves much of my district in northern Columbia County, some of the only maternal care in the region. This bill will ensure not only that we provide the resources and the understanding to bring more healthcare services to the communities that need it. And so I thank the majority leader for bringing this package to the floor. We have so much more work to do here in New York to make sure that every single person, regardless of their income, their background, or where they live, have access to the health care that they need. And I'm proud to vote aye on this bill. Thank you, Mr. President.
Senator Hinchey to be recorded in the affirmative. Announce the results.
In relation to calendar 79, those senators voting in the negative are Senators Ashby, Borrello, Kanzari Fitzpatrick, Felder, Gallivan, Griffo, Helming, Lanza, Matera, Murray, O'Mara, Ort, Palumbo, Rhodes, Rollison, Steck, Weber, and White. Also, Senator Tedisco. Ayes 37, nays 19.
The bill is passed.
Calendar number 83, Senate Print 348C by Senator Claire, enactment of the Public Health Law.
Read the last section.
Section 3, this act shall take effect immediately.
Call the roll.
Dabo, Gianaris, Krueger, Ort, Stewart, Cousins, White.
Announce the results.
In relation to Calendar 83, those senators voted in the negative are Senators Ashby, Borrello, Castanet Fitzpatrick, Felder, Gallivan, Griffo, Helming, Lanza, Martins, Matera, Murray, O'Mara, Ort, Palumbo, Rhodes, Rollison, Steck, Tedisco, Weber, and White. Ayes 40, nays 19.
Bill is passed. There's a substitution at the desk. Secretary will read.
Senator Clear moves to discharge from the Committee on Women's Issues, Assembly Bill number 2656, is substituted for the identical Senate Bill 201, third reading, Calendar 95.
Read the last section. Substitution so ordered. Secretary will read.
Calendar number 95, Assembly number 2656 by Assembly Member Walker, an act to amend the insurance law.
Read the last section.
Section 2, this act shall take effect on the 1st of January.
Call the roll.
Adabo, Giannaris Kruger, Ort, Stewart-Cousins, White.
Announce the results.
Ayes 59.
The bill is passed.
Calendar number 96, Senate Print 2039B by Senator Brute, an act to amend the public health law.
Read the last section.
Section 3, this act shall take effect on the 180th day and shall become a law.
Call the roll.
Adabo, Giannaris Kruger, Ort, Stewart-Cousins, White.
Senator Brooke to explain her vote.
Thank you, Mr. President. And I want to thank our Majority Leader and the State Senate for bringing this bill again to pass this year. So one of the things that I talk a lot about is the maternal mortality crisis and the fact that it's getting worse and worse here in New York State. One of the things that we need to understand is that one of the most common pregnancy complications you see are maternal mental health conditions. 1 in 5 birthing people are affected by one of these conditions. And as with so many things in our healthcare systems, we see that once again, Black women are disproportionately impacted in that we are twice as likely to suffer from one of these mental health conditions, but half as likely to get the care that we need. And so what this bill will help do is make sure that that first moment of being able to detect and diagnose a maternal mental health depression specifically is usually through a questionnaire. And what this will do is widen the opportunities for a provider to offer that questionnaire, including at well child visits. Because I know it is true for many, many parents that we often put the wellness and health of our children ahead of our own, even when we are in need. And so by offering these questionnaires and the ability to diagnose someone who might be suffering from maternal mental health condition, we're actually going to make sure that more birthing people, more mothers postpartum are able to get not just the diagnosis, but the treatment that they deserve. And that we know will also mean healthier infants and children as well. So again, I thank this body for understanding the importance of addressing maternal mental health in this way and proudly vote aye.
Senator Brooks will be recorded in the affirmative. Senator Ramos to explain her vote.
Mr. President, you know, it's the 51st anniversary of Roe v. Wade today, and I couldn't be prouder to be part of a legislature that not only codified Roe v. Wade, but has really ensured that we are boldly a pro-choice state. Now that we've taken such bold action to protect the right to choose, we should reframe how we think about reproductive justice. It's about more than making abortion safe and accessible. It's about providing security, dignity, and care at every stage of a person's reproductive journey. It's about making pregnancies and births safe, especially for women of color who have worse outcomes. And I want to especially thank Senator Brooke and all of the other legislators, all of who I believe are women, who are passing bills today to really take care of mothers in waiting. We know that depression actually does have root causes, and more often than not, poverty is a big reason why women grow sad and sadder by the day as they continue to worry about how to provide for their child. And actually, this session, Senator Brooke and I have been working on a bill called MILK, Mothers and Infants Lasting Change, which would be a monthly allowance for women who are members of households earning less than $39,000 a year, who would receive a monthly stipend as they are waiting to become mothers and within the first 18 months of a child's life. So this is one of the many measures that we'll be fighting for in the budget, and I'm very proud that under our Majority Leader Andrea Stewart-Cousins, we continue to push forward and make sure that New York is a leading state for mothers and children. Thank you.
Senator Ramos to be recorded in the affirmative. Announce the results.
Ayes 59.
Bill is passed.
Calendar number 97, Senate Print 3219A by Senator Clear, an act to amend the public health law.
Read the last section.
Section 2, this act shall take effect on the 180th day and shall become a law.
Call the roll.
Adabo, Giannaris Kruger, Ort, Stewart-Cousins, White.
Senator Clear to explain her vote.
Thank you, Mr. President, and I too want to thank our Majority Leader for her sensitivity and in the inclusiveness of these very important bills today that are going to affect birth outcomes and maternal health in women, and particularly women of color. I have 3 bills in this package today. I'm very happy that the first bill would ensure those who are pregnant can access comprehensive health insurance immediately without fees or penalties. It is very important for our children to have a healthy start if their mothers are being taken care of while they're pregnant. And also the second, which deals with our reproductive freedom and equity grant program, and it ensures that organizations that provide women's health care, including abortion, and fully support and fulfill their mission in a post-Dobbs world. We have to make sure that we secure that right. And this bill that we are looking at right now, which is a bill that would increase awareness and outreach, particularly to vulnerable populations such as Black women, concerning uterine fibroids, so that more people will know the symptoms and seek a timely diagnosis and course of treatment. These bills, in combination with all the bills that have been brought forth here today, will ensure that millions of women are protected, supported, and empowered, and I proudly vote aye.
Senator, cleared to be recorded in the affirmative. Announce the results.
Ayes 59.
The bill is passed.
Calendar number 98, Senate Print 3529A by Senator Fernandez, an act to amend the general business law.
Read the last section.
Section 3, this act to take effect 12 months after it shall become a law.
Call the roll.
Addabbo, Gianaris Kruger, Ort, Stewart-Cousins, White.
Senator Fernandez to explain her vote.
Thank you, Mr. President. I too want to thank this body for supporting this piece of legislation that takes a very preventative measure to making sure that women's reproductive health is safe and continues to be safe. PFAS is a chemical that unfortunately is in many of our daily products that we use, and when it comes to feminine hygiene and the pads and tampons that we use, these are products that are very close to our bodies, and they have long-lasting harms. So this bill would prevent that product, that chemical, from being in our menstrual care products to prevent any reproductive harm. And when we look at a women's experience and choices in life, we want them to be fully healthy before making that ultimate decision to carry a child. We want their reproductive organs to be taken care of and healthy and not harmed by unneeded chemicals. So I thank this body for supporting this bill, for caring about our reproductive organs and preventing PFAS from being in our menstrual products.
Senator Fernandez to be recorded in the affirmative. Announce the results.
Ayes 59.
The bill is passed. There is a substitution at the desk. Secretary Reed.
Senator Webb moves to discharge from the Committee on Women's Issues, Assembly Bill number 5576, and substituted for the identical Senate Bill 3610, third reading calendar 99.
Substitution so ordered. Secretary Reed.
Calendar number 99, Assembly number 5576 by Assembly Member Salitti, an act to amend the public health law.
Read the last section.
Section 2, this act take effect on the 180th day, it shall become a law.
Call the roll.
Addabbo, Gianaris Kruger, Ort, Stewart-Cousins, White.
Senator Webb to explain her vote.
Thank you, Mr. President. I rise to explain my vote. No, I would be remiss in this moment, again, if I didn't join in the sentiments that have been shared thus far in expressing my gratitude and appreciation to Senate Majority Leader Andrea Stewart-Cousins for advancing this very comprehensive and important first step, or continuation of steps, rather, in addressing reproductive and maternal health outcomes here in New York. And so this legislation seeks to provide information to increase transparency as it relates to the racial disparities of pregnancy and birth outcomes by expanding upon an existing law that is aimed at presenting important information to prospective mothers. Prior to serving in the Senate, I had the opportunity to serve on a statewide task force that looked at racial and ethnic disparities in healthcare, and to no surprise by many of us, but still a call to action, there are still significant health disparities as it pertains to race and also socioeconomic status when it comes to these issues. And yet we have an opportunity to do something about it, and also an obligation. And with this legislation, it lifts up this evidence about how expectant mothers and birthing people in BIPOC and rural communities are often presented with limited options for prenatal care and childbirth, and we need to provide information to expectant mothers that will help them to make an informed decisions. Statistics have demonstrated that Black women are at least 3 times more likely to die from pregnancy and birth-related complications and are 50% more likely to suffer severe pregnancy and birth complications. This doesn't happen just out of nowhere. There are policies and practices that institute this. And so this legislation will empower women with the information they need to make informed decisions about their care and the care of their infants. Current law requires hospitals and birth centers to distribute informational leaflets that include information on statistics related to maternal procedures performed at the hospital or birth center to maternity patients before they are admitted. The information must include birth-related events and procedures such as vaginal or cesarean births, use of forceps or vacuum, inductions, vaginal births after prior cesareans, and other vital statistics. This legislation would expand the information about the facility so that way patients are making more informed decisions. And again, I want to thank the Majority Leader and all of my colleagues today for the legislation that they have advanced, and I proudly vote aye, and I encourage my colleagues to do the same. Thank you.
Senator Webb to be recorded in the affirmative. Announce the results.
Ayes 59.
The bill is passed.
Calendar number 100, Senate Print 5991A by Senator Prasad, an act to amend the public health law.
Read the last section.
Section 2, this act shall take effect immediately.
Call the roll.
Adabo, Giannaris Kruger, Ort, Stewart Cousins, White.
Announce the results.
Ayes 59.
The bill is passed.
Calendar number 101, Senate Print 5992A by Senator Prasad, an act to amend the public health law.
Read the last section.
Section 2, this act shall take effect on the 90th day after the child become a law.
Call the roll.
Adabo, Giannaris Kruger, Ort, Stewart Cousins, White.
Announce the results.
Ayes 59.
The bill is passed.
Calendar number 102, Senate Print 7700A by Senator Webb, an act to amend the public health law.
Read the last section.
Section 2, this act take effect April 1st, 2025.
Call the roll.
Adabo, Giannaris Kruger, Ort, Stewart Cousins, White.
Senator Webb to explain her vote.
Thank you, Mr. President. I rise again to explain my vote. This legislation takes into account different resources we have at our disposal that can also help to address maternal health outcomes. This specifically focuses on the ability for patients to use an app. And so in a district like mine, where we have noticeable rates of low birth weight and premature births, along with elevated levels of neonatal withdrawals and infant mortality, such outcomes have often been seen among those with lower rates of health literacy, which is a hurdle that is especially clear for first-time moms. Those who are under the best circumstances, they also are often facing knowledge gaps. And so this legislation would allow for Medicaid patients to utilize an app that would allow them to close some of those awareness gaps. So this legislation does several things. Not only does it provide opportunities for more awareness and information, but also resources that can help to decrease poor outcomes for infants and mothers. Through the creation of a consolidated pregnancy app, we'll be able to provide New York-specific, expert-backed information to all Medicaid recipients to support them in their prenatal, pregnancy, and postpartum services. This will allow individuals to have a one-stop shop of information from the Department of Health and other state agency programs in order to receive vetted best practices, find the closest providers, and access supportive care. We know that even these simple interventions can have meaningful and long-lasting impacts. There are other states that have implemented this particular resource, such as Michigan, which again helps to raise awareness and help to improve maternal outcomes. I'm very proud to sponsor this legislation that will empower rural and low-income women eligible for Medicaid with access to a mobile app to ensure access to prenatal and postpartum obstetric care And again, I want to thank the Majority Leader for supporting this legislation. I proudly vote aye, and I encourage my colleagues to do the same. Thank you.
Senator Webb to be recorded in the affirmative. Announce the results.
Ayes 59.
Bills passed.
Calendar number 103, Senate Print 7702A by Senator Webb, an act to require the Department of Health to convene a maternal health care and birthing standards work group.
Read the last section.
Section 2, this act take effect on the 90th day and shall become a law.
Call the roll.
Addabbo, Giannaris Kruger, Ort, Stewart Cousins, White.
Senator Webb to explain her vote.
Back for one last time, at least just during this session today. You know, one of the things I wanted to remark is that, you know, the legislation that's before all of us today that we've been voting on, that yes, this is legislation that's been advanced by women legislators in our chamber, but I wanted to be very clear that the responsibility of reproductive and maternal health care does not solely fall upon the shoulders of women legislators. It is our collective responsibility in this regard. And so again, I want to thank the Senate Majority Leader for not only recognizing this, but also for bringing this important package of legislation to the floor. And so with this particular bill, it will allow for a comprehensive and holistic approach to address the maternal and infant mortality crisis by directing the Department of Health, the Commissioner, to convene a work group of stakeholders to holistically review maternal health and birthing standards. So when you hear statistics such as 3 times as likely to die, hundreds of thousands of people or children being born with low birth rates, what does that mean? How do we begin to wrap our arms around what's happening in our state? In a state with as many resources as we have, we can and should be improving maternal health outcomes, and that's why this work is critical. This work group will be looking at not only the data, but also trying to examine best practices, recommendations that can truly help to improve birth outcomes and reproductive care for all New Yorkers. And so Governor Hochul recently announced a new proposal to address components of the maternal and infant mortality crisis, including access to care, maternal mental health, and the unnecessary use of C-sections in the birthing process. This even goes up to the federal level because the Biden administration in June of 2022 released the blueprint for addressing the maternal health crisis, which drew attention to the increased need for women to be supported as active participants in their care throughout and after pregnancy, and as reflected in the Momnibus federal legislative package co-sponsored by the Congressional Black Maternal Health Caucus. So with that being said, this legislation takes into account all of those conversations and legislative proposals, and now from our respective chambers, we are taking it to the next stages. And so again, this work group complements all of these things and will ensure a comprehensive and thoughtful review of maternal care to ensure that birthing people in New York are receiving the highest standards of care. Thank you, Mr. President. I proudly vote aye.
Senator Webb to be recorded in the affirmative. Announce the results.
Ayes 61.
The bills pass. Senator Giannaris, that completes the reading of today's calendar.
Is there any further business at the desk?
There is no further business at the desk.
Move to adjourn until tomorrow, Tuesday, January 23rd at 3 p.m.
On motion, the Senate stands adjourned until Tuesday, January 23rd at 3 p.m.